These big carrier networks, once you understand what's going on, all they do is contractually obligate you to pay the highest possible price. When you design these plans well, an employer would much rather pay 100% of a $500 MRI than 80% of a $5,000 MRI.
I literally had an employee, she was crying because we saved her so much money versus the status quo.
You know, they're a healthcare provider. They can't really claim ignorance about prices on out-of-network claims and things like that.
What we're up against, it's fear. I had a CEO tell me point blank, this was the hardest decision I had to make.
Are you sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
Ladies and gentlemen, welcome to Broken Healthcare. My name is Ray Kober, and I am your host. I'm thrilled to have with us our next guest, none other than one of the fathers of the movement against the status quo in healthcare, Dave Chase. Dave is a best-selling author and co-founder, CEO of Health Rosetta, and that has also spawned a conference, which I believe is coming up in September. We're going to hear all about that and more. Welcome to the big show, Dave.
All right. Well, looking forward to the chat. Thanks so much for having me.
Right on. So there's so much to talk to you about. You're a very interesting cat. I mean, you've got a very diverse background. It didn't start in healthcare. I'd love for the audience to learn a little bit more about you, as much as you're willing to share. We have as much time as you need. We, of course, like to keep it entertaining and engaging, so we don't need the minutia, if you will. But how did you stumble into the healthcare game? Where did your career start, and was it a straight path, or were there some twists and turns?
Definitely some twists and turns. So I started my career in management consulting working for Accenture and worked in a few different areas, but mostly I worked in healthcare. So it was just, young guy out of college. They put me in hospitals and essentially helping put in IT systems. And so that was my first taste. And then I left Accenture for Microsoft. I thought I'd left healthcare, not that didn't like it, but I just didn't think Microsoft and healthcare were going to go together at all. Lo and behold, a couple years in, bottom line is I started their healthcare business. A lot of people don't really realize they have one, but it's actually, they kind of make Legos that other people assemble into solutions, might be the way I describe it. And if you fast forward to today, the thing I started, many other people contributed. But today it's about a $30 billion ecosystem of 28,000 partners building around Microsoft's platform. That was a long time ago. This thing called the internet.
But that's, if you don't mind, that's amazing, given that you started at about 100 million from what I read, right?
100 million as far as what?
As far as what the business was worth. You said now it's a $30 billion business.
Basically the way Microsoft tends to look at things is the ecosystem of partners around them. And a healthy ecosystem, the company that's sort of the center of it, whether it's, Apple with all their apps or Microsoft, with their enterprise software, they get about 10% of that 30 billion. And so that it's probably about, I haven't asked recently, but it's probably about a $3 billion a year revenue business for Microsoft. And then if you look at all the partners around them, that's about 30 billion. So there's companies that you might have heard of like Epic or Cerner in the, hospital billing space that they build around Microsoft technology for some of their solutions. So that's kind of what I was getting at. So yeah, I signed the very first partner on a Microsoft's platform. This was when Microsoft really wasn't a player in terms of the enterprise. They just had some desktop software at that point. a long time ago. And now it's, if you look at most doctors' offices, most hospitals and so on, you peel back the computers there and they're running on top of some Microsoft software.
Yeah, it's amazing. And so you were the guy that they handpicked for this, or you were part of the team?
No, I was the guy. And, the healthcare department at Microsoft could have fit into a phone booth because that was me. And yeah, it's a lot bigger now. But yeah, it was a crazy time. I was not that old, probably my mid to late 20s, but it's
Yeah,
sort of the way tech companies work. Like, you had a very young stage of your career. They're like, here, go. And that was
yeah,
like about the direction I got. And, all I knew was these companies that make the industry specific solutions. It was kind of a test. There was two industries at the time, banking and healthcare. And then essentially that guy, a guy named Bill Anderson, and I kind of figured out how to tackle industries and, how to, build credibility and ultimately build partnerships. And then, if a company like Microsoft gets a company like, say, Cerner to move onto the platform, like, that's not much of a monetary event. But once they move their install base from, back then it was like mainframe computers, then it
yeah,
becomes a cash machine for a company like Microsoft. Now, Cerner in that example makes a lot more money per customer than Microsoft, because they're selling a very industry specific complex system that
yeah.
might cost tens or hundreds of millions of dollars. But every time they sell, pulls along Microsoft, just like, you bought a PC and it had Windows. You might have bought it from Dell, but it has Windows on there. Microsoft makes a little bit of money.
The
So that's,
organization is getting to wet their beak a little bit.
yep. And then
Right.
it
Yeah.
has a really long tail, right? Of just, it continues to put out more and more devices, and that more revenue for them. And so, yeah, that
Yeah.
was what I did until I shifted over into internet-based
So I
businesses.
mean that's amazing, just because it's these are Bill Gates, from what I've read and know, is one of the most competitive people on the planet. He's super competitive. He runs the organization that way from the top down, and so I would imagine the competition for a slot like that must have been pretty fierce. And so for you to be the guy is incredibly it's impressive. That in and of itself. But I think what's more impressive, my curiosity is piqued by, why the hell would you leave a gig like that?
Yeah, that's a good question. Yeah, and I would say it was very competitive to get into Microsoft at that point in time. But I think they were just desperate. There was nobody who knew healthcare except me. So I was
Right
lucky.
place, right time.
Yeah, and so now it was very, you know, it's very demanding to stay in that job and to produce results.
Yeah.
And so it's not like you can just sit on your fanny at that point. And I was, very gratified the year that I brought Bill to this big event called HIMSS. It's the Industry Association for Health IT. At the end of the year, he said that was, of all the different meetings and keynotes and all that he did, that was the second best use of his time all year.
Mm,
And that was the
yeah.
year that Microsoft released Windows 95. So old people may remember like how big of a launch that was. So that was a pretty cool event. But why
Usually.
would you leave is a good
Yeah.
question. Well,
Yeah.
Microsoft is a very product oriented company. And if you want to, make a big dent, I never thought it would get as big in healthcare as it did. And there was this thing that called the internet that had come along, you might have heard about.
Oh, that little
And
thing?
yeah, and so there was an opportunity to take a product leadership role in there, and that was just compelling, right? And
Sure.
I had woven some of this internet stuff into some of the vision that Bill talked about in his keynote at HIMSS, and so it was just an incredible opportunity. And so that just ran its course, and including after I left Microsoft, I just realized I like new businesses, startup businesses. And, I left Microsoft literally 20 years ago. It's been over 20 years. And, and I was still out of Microsoft, out of healthcare until, 10, 12 years ago. And I was away probably 10, 12 years. And people are like, gosh, why didn't you go back into healthcare? You had all this knowledge and all that. It's like, well, from a technology perspective, um, healthcare is kind of a backwater, right? And I'd say startup, healthcare is where startups go to die, and healthcare is always like 15 years behind. And so I like startups that succeed, not die. And so it was only when I had a personal situation with a tragedy with a friend that really compelled me to come back. And I realized that there were some forces coming together that were going to shake up healthcare and make it a dynamic place from a technology perspective. But honestly, I really shifted, like what I'm doing now. We have technology that's certainly a key element, but like we don't frame ourselves as a technology organization. Healthcare is the only industry that I know of that uses technology as an excuse for prices to go up and productivity to go down, because we have a radically flawed system. And that system, the basically killed my friend. And that's what compelled me to come back. Not because there was, bad doctors, but we just had a bad system. And the system is fully defined by health plans. Like, what's a health plan, right? It doesn't provide care, but it sets the rules for everything in healthcare, best as I can tell.
Now, Dave, I don't want to go too deep or get too personal as
Yeah.
much as you're willing to share, but you mentioned your friend now twice. Can you give us some context for what you're talking about there?
Yeah. No, I'm happy to provide that. So my friend got a cancer diagnosis. Unfortunately, in our system, 1 out of 5 times that diagnosis is going to be wrong. And that was the case for her. Of course, if you get the wrong diagnosis, you don't get a second opinion. You're going to get the wrong treatment plan. And of course, that's not going to heal you. That's going to add misery. And not only physically, ultimately, doing her in, but as a person who had a pretty successful tech career, was definitely not, living hand to mouth, and it bankrupted her. And it ruined her emotionally. She was a single mom. She had a 10-year-old daughter. And basically her legacy was bankruptcy and financial ruin. And that really caused me to unpack why this system had failed. And, even though I was in healthcare, like health plans, health insurance, right? It may as well be a completely different industry if you're in the health tech side of things. It's just whole new set of things to learn.
Apples and
so
oranges.
That put me on the quest to sort of figure this thing out. And you don't figure it out overnight, but bit by bit, you meet great people, you start to understand, and you go to kind of school, so to speak. Not literally, I went to school, and you realize, and having that fresh perspective. Yeah, I had a healthcare background, but I didn't have any healthcare insurance background. And I remember, one of my co-founders is a guy named Sean Shanson. Sean and I were, and then later Melissa joined us. I remember the earliest days, we're like, this is so weird, right? Where everything we do in our life, practically, like you go, hop in an Uber, like you can rate them, they can rate you, you can get JD Powers, Consumer Reports. Like, one of my goofy examples is there's some shower curtain on Amazon that has 235,000 reviews. And 20% of our economy, there's not an objective mark of value. And so that was like, if you're going to change things, like first you need to assess value. And then if you look at successful, revolutions, America should be a country, or, social movements, women should vote, or whatever, or new product category introductions, like, the old iPhone. The common thread is they reset expectations of what life should be. And so if you're going to reset expectations as to what excellence is, most people think that, national logo on the back of your insurance card is as good as it gets. That's just patently false.
Yeah.
And the high performance health plans that, when I wrote this book and I did my TED Talk, I found they weren't 2%, 5% better. They were 10x better. And I was like, man, this is the easiest problem in the world. It's dystopia over here. It's bankrupting people and, making clinicians' lives miserable. And over here, oh my God, it's like utopia by comparison. Of course, it's not an easy problem. There's nearly 5 trillion reasons to protect the status quo. But you know what? I'd been a part of 2 large-scale industry ecosystem shifts. And the funny thing was, early on, I resisted the call because when I re-entered, one of the things that I thought was kind of a encapsulation of the future of healthcare was direct primary care. So I was the first national writer to write about that. I wrote the seminal paper on direct primary care. And yet it was nobody knew about it. So I started writing about it. And I've had countless docs say, you know what, I read your stuff in Forbes or in Huffington Post or the healthcare blog, and I changed my career and I'm doing it. And they became leaders.
Wow.
Cool.
Yeah.
And so I thought the same thing happened with Health Rosetta. It's these people cracked the code. They found the Rosetta Stone that deciphered this indecipherable system. And I wrote about it, and somebody will go do it. And people are you going to run with that thing? I'm like, no, I'm just writing about it. And they're like, you should do it. I'm like, no, you should do it. And
Right.
Eventually I'm like, okay, I actually have, as I unpacked, this is of course an incredibly difficult thing to tackle. But if you look at some of the attributes to have a chance of success, I actually had that background. And I was like, oh man, it's time to man up.
I might have to do this.
Yeah. And so it's sort of I don't know if you ever, there's an old movie called Stripes that Bill Murray was in.
Of course.
Where they have all these military guys and they ask for a volunteer for something, and everybody takes one step back and there's one guy, sitting in the front. That was kind of me. It's oh, I guess I better do it.
You were
and
voluntold.
It's hard work, but it's people like you that are passionate about, they kind of, you can't unsee, what's happening, and you have to do something. And so that's
what's remarkable, Dave, is I went out and I looked at your TED Talk again, and it's a brilliant talk. So for those of you that haven't heard Dave Chase's TED Talk, just Google it, put it into YouTube. You'll come up with it easy enough. And it's not very long, but it is compelling. And it holds true today as it did then. But, the curious thing for me was you just a few breaths ago said 5 trillion reasons why. You remember the number on the slide you had back in 2017? Of course,
3 trillion?
3 trillion. 3 trillion.
It's almost 8 years ago. And I watched it not that long ago. I was like, oh, am I just going to look like a total fool? Because I didn't know that much right at that point.
Right.
I was like, actually, most of it's still true, right? It's
really
just gotten worse, right? 3 trillion was horrific.
Yeah.
And the ways.
But that's my fear is in this crusade of ours, and we have the same passion, and that is kind of righting the ship and scoring one for the little guy, because most people in the United States have far less than $1,000 saved for a rainy day. The last statistic that I read and study that I read was more like $400, $600 for a rainy day. So they can't, the average person just cannot sustain a catastrophic health event and their share of the costs. It's just untenable. It's not something that they can deal with. And, case in point, you had a good friend who had a cancer diagnosis, who was a successful tech, professional, and it drove her to bankruptcy court. And so when we're in this predicament and we have a fifth of our economy now driven by healthcare, nearly 20 cents on every dollar, and the rates just keep going this way. And as a tech person, you know that we have the tools to solve this. I'm not plugged into advancements in what blockchain has done for healthcare, but in my mind's eye, that is a perfect application for blockchain technology in terms of righting this ship and having an audit trail and an audit system and transparency. It's way more complicated than it has to be.
Yeah, no, and it's by design, right? It's complicated so that people will throw up the white flag and just say, this seems unsolvable. Like, this is like trying to solve Middle East peace or something.
Forget it.
Yeah.
I have other things to worry about. This is not a priority.
Yeah, you just pray that nothing's going to happen to you or a loved one or a friend or whatever.
Well, the other interesting thing that you said, not to cut you off, is people rely on that logo on their ID card, and I think the association that they make with a United or an Anthem or pick a flavor Cigna logo is it's like Mercedes-Benz or Rolls-Royce, or it's not the same, right? It's not. We're not talking about a logo that these organizations do not dispense healthcare.
Yeah, no, I would say like healthcare is not expensive. If you look at that nearly $5 billion,
trillion,
trillion. Sorry,
it's an easy mistake to make.
The 5 trillion. Only about $1 trillion of that is actually going to what most normal people think of as healthcare, like what doctors and nurses do. Sure, we need some overhead. We don't need 75 cents of overhead for every dollar. And I say, like, the care is not expensive. It's the profiteering, it's the price gouging, it's the administrative bloat, it's some fraud, it's some inappropriate care that's expensive. And it's just kind of common sense and shockingly common now that the all-in costs in this kind of new economy, it's really this new parallel economy has emerged. The all-in cost of a medication, a lab, an imaging, even surgeries in this kind of new market, this kind of direct contract, streamlined, really dramatically reducing administrative burden on all parties, is literally less than the cost sharing component. You have this $8,000 deductible. Like, there's surgeries that are, they're charging, like, that's the notion of these big carrier networks. Once you understand what's going on, all they do is contractually obligate you to pay the highest possible price, even though it's logical to think they're going to be able to get a discount on it. And there's a bunch of reasons why they could, but they don't. And so, of course, even if it wasn't the all-in cost, when you design these plans well, an employer would much rather pay 100% of a $500 MRI than 80% of a $5,000 MRI.
Sure.
And so Johnny Lunchbucket you were talking about earlier that doesn't have, more than $400 of savings. And if you say, hey, this is the same equipment, literally the same equipment in that case, you can go here, you're going to pay zero, or you can go and deal with the brain damage of copays and deductibles, and, they'll, set you up on payment terms, like all that kind of nonsense.
Right.
It's a no-brainer. Once you do some basic level education of the members, and if you look at the members we're talking about that really need our help the most, during COVID times, we called them essential workers, right? They were hospitality, manufacturing, logistics, first responders. Those are the people who are really getting the short end of the stick. I mean, this stuff is helpful everywhere, but the people who have only $400 of savings and a bad stubbed toe may mean financial ruin. Like, we can help them, and we help them every day. And that's what's really so rewarding. Yes, we're working on this tough long-term problem, but the day one of these plans goes live, it will bring tears to your eyes. People were terrified of the healthcare system, which is about half of Americans, delay care because of the cost. They now can afford a medication or a surgery or whatever it is that they may have needed. And there's no reason to have a barrier in there if you get rid of kind of the noise, the
Yeah.
administrative barriers that are there.
And I've experienced it firsthand where we rolled out a custom plan to a group that had a fully insured plan prior to us coming in, and we were there for the first renewal that they had with us. And I literally had an employee. It wasn't an in-person; it was a virtual. But she literally was crying because we saved her so much money versus the status quo and what she was used to paying, because she had access and a path to actually $0 out of pocket. It literally changed her life, and she was moved to tears. And so when you experience that, it's very gratifying, and it just, puts wind in your sails, because the God's honest truth, Dave, is what we're up against. And I think you said the word, it's fear. And it's not only fear at the employee level, it's fear at the leadership level. The leadership is literally afraid to make these decisions because of the ripple effect and the impact. And so there are many, many hurdles like along the way. And I had a CEO tell me point blank, it was the same organization actually. He said, this was the hardest decision I had to make.
Yeah, no, it's hard. And
Yeah.
that is, we have a 5-step change process that we recommend people take. And they don't have to do it in this order, but we think it's a good way to go. And four of the five steps are either invisible to the member, that individual that they're concerned about changing, or clearly a positive. And the first step, by far the biggest hurdle, is the mindset shift. Like that if they think this is an unsolvable problem, they're right. If they think it's a solvable problem, they're right. And once you clear that hurdle, and then the next thing we get into is like, these are companies that, we just have these weird differences of behavior inside of companies. There'll be a company who will reject an expense report from some employee for $76 at the restaurant, and they have a $75 report. They'll reject it. And then they'll pay sight unseen a 6-figure bill, which I can tell you, having worked inside of hospital billing departments, I don't know if there's ever been a bill over $5,000 or $10,000 that hasn't had an error. And so one of the scenarios we had like that conversation you talked about, it's a case study in one of my books called Copper State, that all they did as the first step was they just reviewed the contracts, got rid of some junk fees and some bogus stuff. But mostly what they did before they changed the network, before they changed the PBM, before they did anything with primary care, any of that stuff, they just looked at every claim. And most of them had errors. And then the other thing people do is, okay, maybe it's too big of a leap to leave behind these networks that you think are valuable, but they're just glorified yellow pages. There's bad doctors and great doctors. There's good facilities or bad facilities. And so if you have somebody to guide them to the best doctors and the best facilities, even within that existing structure, it's very helpful. And then the decision makers go, and in their case, they had about 1,000 employees. They saved, kind of before doing anything, $1,000 per employee per year. That's $1 million, right? That got their attention. Like, oh my gosh, like we should do some more stuff. And it sort of set the stage for the rest of it. And we found with this plan grader I was alluding to earlier, that we built out this way to grade a plan. 95% of employers under 1,000 employees, which is probably 2/3 of the workforce, never look at the contracts that are in their health plan, right? They treat them like terms of service on some consumer website. I'm like, check, agree. Like, I'm not going to read that thing. But unfortunately, when they sign that, they are basically giving the industry an unlimited corporate credit card to have the most badass parties ever, right?
I'm sure it's north of 99%.
Order the Dom Perignon, get the...
Nobody reads that stuff, Dave.
Right. And that's the thing.
It's the truth.
That's been I would say, the most unique investment that we've brought to the table for our, this is a team effort, right? It's not just us. There's a bunch of people, but the thing that's been our biggest investment other than our own people, and I think the biggest investment that anybody has made on kind of the good guy side of the equation,
Yeah.
is relooking all those contracts, reworking them, and we've begun to open source them. So anybody can go to healthrosetta.org/open source. They'll see the first things we've done. We've got a bunch of stuff coming out at RosettaFest, specifically around TPA agreements and PBM agreements and some other stuff. So
what are the dates for Rosetta Fest, and what is Rosetta Fest for our audience?
Yeah, great question. So pretty easy date to remember and location. It starts September 11th in Washington, D.C. So it kind of starts in the afternoon. The main day is Thursday, the 12th, and then we go half day on the 13th. And basically what we do is it's a convening of this new economy I talked about. Yes, it's the benefits advisors that we've worked most closely with, but it's the solutions, right? The good TPAs, the good PBMs. It's the clinical leaders. Like last year, we had over 100 clinicians, mostly physicians. We also had over 100 employers and unions. Both of those will probably double. We're expecting over 1,000 people. It's just grown from when we did this 2 years ago, more in our community, we had a little over 200 people. We are way ahead of where we were last year, where we had about 700. And it's really cool, right, to get these people that are really total allies, right?
Yeah.
The clinicians who've broken out of the system and were kind of tortured by the old insurance bureaucracy, the shackles are off, but they need the real payers, right? The employers and, the unions that are actually paying the bills.
Yeah.
And a lot of what we're doing there is just being connective tissue across the industry silos so that at the end of the day, you have a health plan. It's got to have the things you'd expect in terms of drug coverage and primary care and networks and, all that kind of stuff. They all get together there. And, yes, we operate in a virtual world in a lot of areas, but there's just no substitute for breaking bread, collaborating, rolling up your sleeves. And the centerpiece of that event is an awards show that we called the Rosies. We got the Tonys and the Emmys and the Grammys. Now we got the Rosies. These are the best health plans in America. And so,
Oh, wow.
When I wrote that first book and did the TED Talk, on my LinkedIn profile, I joked that I'm an archaeologist because I had to dig so hard to find, healthcare's Rosetta Stone. Now we're in the low thousands, right? We have a long ways to go, make no mistake.
Sure.
But we have come a long ways. And so the best marketing there is in any field is word of mouth. And the best content for word of mouth is success. And so the industry can say, oh, we tried this, we tried that, we can't do it, it's not impossible, or it's only for companies like this profile. You will see every shape and size company, large, small, public sector, private sector, union, non-union, rural settings, urban settings, suburban settings. We haven't found a place that hasn't worked. Maybe you adjust your tactics some, but there's always things you can do.
And so, Dave, working backwards now, so the conference came after Health Rosetta.
Yes.
What was the impetus of Health Rosetta, and what is Health Rosetta?
Yeah. No, that's a great question. Really, it's about making it much easier to build health plans for employers and unions. And unfortunately, health plans have been the enabler, being the number one driver of wage stagnation and decline, number one driver of debt, number one driver of bankruptcy. That doesn't need to be the case. So we show, and that's really what the idea with like the TED Talk in that book and then this organization was, gosh, if we just share what's working and we bring together, problem solvers, everybody will want this and it will spread around. And so, we train and tool advisors and employers and the solutions, things like the plan grader. That's been our biggest technology effort. Took us many years of sort of having hypotheses. If you'd had this in your contract, would it be predictive of high performance? And literally, we conceived of this from the inception, but really didn't bring it to market until the last couple years. Now we got 2,000 plan grades in the system, and so whether it's at the event or we do webinars, we're just giving people, like yourself, maybe earlier in your journey where you didn't know this stuff as much. Here's how you do it. And then even if you know how to do it, what we found pretty quickly is you do more than 3 or 5. If you don't have a system in place, it becomes death by 1,000 paper cuts, right? Because there's so many different moving parts. They're really powerful. But there's
wait, I thought death by 1,000 paper cuts was my wife's Amazon account. No.
Yeah, right. And it really can be, it's not that any of those steps are rocket science. It's just there's so many, and it's very easy to forget. And so we have this unfair advantage that we've created this community that all these people who've had all this success, it wasn't me climbing to the top of some mountain and dreaming this stuff up. I just made sense out of it. Right? People did, and collectively we did this, and then created this blueprint. And then we just try to make it easier and easier and kind of make it like Lego blocks putting these things together.
And I think it came on your radar that this was possible because there was a particular organization down south that had a CEO that just looked at this and it was dragging on his company, and he just knew in his gut that there had to be a better way. Tell us a little bit about how you learned of that story and who the players are and all that.
Yeah, good question. It was sort of like early on, it was a scavenger hunt, like just is anybody figured this thing out? And that's kind of how I found about direct primary care and the importance of primary care. I didn't really fully understand it. And I'm like, who's done this? And then somebody said, man, these Rosen Hotels people in Florida, they've really done a cool thing with their primary care. And that's kind of all I knew to begin with, was they'd done something cool with their primary care. And then I dug in and like, oh my gosh, like this doesn't sound real or possible what they've done. And if you look fast forward to today, over their 30-year journey, and they're in the state that has the most, like 40% of the most price gouging hospitals in America are in Florida. It's not an easy place. And their workforce is not easy in terms of kind of disease burden. They have kind of the typical stuff that many workforces have of hospitality industry. On top of that, high rates of TB and HIV. 56% of their pregnancies are categorized high risk. Right, that can be a budget buster if you don't have a good game plan.
Yeah.
They, over those 30 years, they have cumulatively saved $540 million benchmarked against other hotel companies. Mind-boggling. While they went from 500 employees to over 5,000, and they became the inspiration for what we define as our purpose. Like the reason we exist, I kind of maybe cutely put it like, we transform healthcare's waste into fertilizer for restoring the American dream, right?
Yeah,
that's what they did because they saved all that money. Great for their business, of course, but they have incredible health benefit plan, great primary care, all that. But where it really gets shocking is they take a fraction of what they've saved and they say, you know what? The American dream for, and Mr. Rosen, like son of immigrants from Eastern Europe, I think. And he said, we're going to invest in our employees and our employees' kids, and they will fully pay for, basically state-based education, whether it's a community college or Florida State or whatever. That's like up to a $260,000 investment.
Amazing.
And you can imagine what that does to their employee turnover. It's like 1/6 of the level of their competition. And, it's a high turnover industry.
Sure.
And like, if that wasn't enough, they said, gosh, there's this neighborhood nearby us that has a lot of crime, a lot of drug issues. We're going to invest in kids and education. So they fully funded daycare, after school programs, pre-K and college educations, crime goes down 80%. High school graduation goes from some of the worst to some years it's literally 100%. Like if you start in this grade school, you get to high school graduation, you're basically getting like one of those big Ed McMahon checks. We're going to pay for everything.
Right.
Um, and
Yeah.
and then it worked so well, they went to a neighborhood 5 times that size, applied the lessons. So like that's what's possible when you don't squander money. We call that the Health Rosetta dividend.
The amazing thing about that story is I believe that most CEOs, CFOs, folks with P&L responsibility, they don't fully get it. And they don't get it, I think, no disrespect to any of them. It's just their mindset is that they pay someone to handle this for them, and they are under the false assumption that it's being handled properly. And when you see and I think the other thing is, if we change it, we're gonna be worse off. Everything that you just mentioned as a positive, they're in their minds, they believe the exact opposite will happen. It will have trouble retaining employees. They will have trouble acquiring employees. There'll be a mass exodus. People will be running for the hills. And the truth is, none of that happens when done properly. Now, can you roll out a custom plan or have an advisor that maybe is new to the game or is not proficient, that puts you in a bad situation where you have higher risk and you're more exposed? Certainly, we do hear horror stories of this all the time, but the reality is it's really a payment mechanism. Like if we're going to the simplistic difference between fully insured and self-funded and a custom plan, would you say it's more risky to be in a custom plan than a fully insured plan, Dave?
Well, it depends on the risk you're talking about, right? I mean, if let's say, we got the Olympics coming up. If you went to Paris and hired me as your tour guide, that wouldn't be too smart, right? You'd hire somebody who lived in Paris that actually knew the ins and outs. And so it's not risky if you do that. What's risky is the status quo. You know that the third leading cause of death in America is preventable medical mistakes? Like, that's a horrific figure. Yes. I wrote, my second book was on, looked at our healthcare system through the prism of the opioid crisis. I found 12 major drivers of the opioid crisis. 11 of those 12 major drivers, the key unwitting, and I emphasize unwitting enabler of that, is employers. It's their dollars that funded and fueled the first 20 years of the opioid crisis. That sounds pretty risky to me. 100 million Americans being in debt to the healthcare system, and then by far the biggest driver of bankruptcy is medical bills. 70% of those people had so-called insurance. That doesn't sound like insurance to me. That sounds pretty risky. And even just the terms that we use in the industry, there's like the notion of fully insured versus self-funded. I'm like, wait a second. I don't think anybody outside of Acme Corp is funding that. You are self-funded.
Right.
And all you've done is delayed any risk, because I guarantee you, if you have a bad claims year and magically the carrier loses money, you are now subject to your worst year you've ever had, and it will be baked into your premiums. That is not effective risk management.
No, and I could appreciate all that, and I agree with you wholeheartedly. But what I run into time and time again is the CFO that says they're not interested in self-funding because they are risk averse, which makes me laugh every time.
Yeah, and it's just explaining like you are not avoiding. If it's managed your risks so well, you must have the same premiums as what you had 20 years ago, right? Is that well managed?
Yeah.
Obviously not. And so now there's things you can do. Like I said, do some of these things that are invisible to the members. So that's not really very risky. The other thing I see people do is they don't get rid of the old crappy plan. They just offer a new plan that's compelling. And, when you let members know about that, we would have thought maybe 10% would adopt this new plan.
Mm.
Now it varies obviously, but we'll see easily over half will adopt a new plan once they're aware of what's there. Because you know what? The lowest net promoter score of any industry, which is a measure of satisfaction, is health insurance, like lower than cable companies and airlines. Like,
Oof.
even though there's some Stockholm syndrome with these logos, it is a horrific experience,
Yeah.
right? I mean, just we talked about the debt and bankruptcy, and this is a bill, this is not a bill, and so-called primary care, it takes 4 to 8 weeks. Like, that's not primary care, right?
Yeah.
And just all these nutso things that we just kind of become accustomed to,
Yeah.
and even if it's only 10%, right? Then the word of mouth spreads, and then over time, like, why do we have this other thing here? We don't need it anymore. And so you can, my last book is called Relocalizing Health. The biggest chapter in that book was on change management. So you could have the best design plan in the world and think about these things. If you don't communicate it and roll out well, it's not going to succeed at the same level. And so you definitely want to be thoughtful, but that's no different than, companies, do their ERP implementation, or there's new financials or sales and marketing automation, right? There's always change management. There's project management. Just treat it like what you should, the second biggest expense for a lot of companies. They wouldn't treat anything else in their business like the way they treat health.
For sure. So we're in an election year. Trump, Biden, maybe some other candidate, we don't know. We went from $3 trillion in spend since your TED Talk in 2017, 2018, to $5 trillion, $4.9 trillion projected in 2024. You were involved with some legislation, and I believe, if I'm not mistaken, Marshall Allen, may he rest in peace, was also part of that. You guys worked on this together.
Yeah.
Tell us a little bit about the impetus of this, and where did it come from, and where are we now at this stage, and what do you think we're going to see as a result of this? What have you seen in terms of successes so far, and do you think things are going to get shaken up further with the passing of that bill?
Yeah. I mean, as a little backdrop of why I sort of went down that avenue.
And this is the Consolidated Appropriations Act.
Yeah, the Consolidated Appropriations Act of 2021.
Yeah.
The thing is, I started to understand, what's a regulatory environment? Oh, I hear this thing called ERISA. Okay, what's ERISA? And it's been around since the Ford administration. It's over retirement benefits and health benefits. And there was an unlock in the George W. Bush administration that was similar to the Consolidated Appropriations Act. And that unleashed a series of events that ultimately led to, a couple class action cases that ended up at the Supreme Court, unanimous verdicts against the employer for failing in their fiduciary duty, right? You're stewarding somebody else's money. That's one of the highest duties under the law. And so I was like, wow, why isn't this being happening over here? And if you look at the crux of the issue that went to the Supreme Court was around actually broker compensation. They were Edison International, Northwestern University, 401k, 403b. They were paying retail broker fees when they should have been paying wholesale, like kind of basic, right?
Yeah, sure.
And so by this point, I knew that, and really a founding principle of Health Rosetta was, our feeling is, I actually wrote a piece in Forbes called "This Job Could Save America." I think the benefits broker role is the most underestimated role in our entire economy. And when it's done well, they should be like any other professional, lawyer, accountant, engineer, doctor, right? Paid well, but transparent about, they get paid well.
Yes. Yep.
You pay your accountant, you pay your lawyer a lot of money for a reason. And my co-founder had been in the securities industry, was all very familiar with disclosure and conflicts of interest. And we're like, this is peculiar, right? Where this is really quite bad. We were finding up to 17 undisclosed revenue streams the employer had no idea about. And at that point in time, Marshall Allen I viewed him as the top investigative reporter. He was at ProPublica. And he was doing things on like surgical safety and stuff like that. And I said, man, there's a big issue here. And it was about a year process of educating him, giving him sources, him doing his shoe leather work. And ultimately, the article comes out in just the right time window where the most important Senate committee for healthcare is called the HELP Committee, like Health, Education, Labor, and Pension, I think. And there was, at that point in time, there was a lot of this repeal and replace discussion. And the two heads of that, Lamar Alexander, he was GOP, they were the majority. He was the chair of that. The ranking member was Senator Patty Murray. They're like, hey, there's a bunch of things we can agree on. Why don't we canvass the market for what's out there? And that article came out in that time. And, one of Alexander's staffers called or reached out to Marshall, and they pointed them to me. And then I kind of went through a similar process. Like, here's the way it should be. Here's how we operate. Here's some of the problems. And they wrote into the bill. That and the other really critical thing was that I thought was bizarre was you have a duty as a plan sponsor, an employer, right, to only pay reasonable and prudent fees. How on earth can you fulfill your duty if you don't have access to your claims data, right? This is an obvious thing. And when we looked at the employers who were succeeding, they all had unfettered access to their claims data. And so, unfortunately, it should be a giant red flag. Like, I've been in business a long time. Anytime a business is doing good work, it buries you in data and all this to say what an awesome job they're doing. When they're preventing you from accessing what you have a legal duty to do, big red flag. Sure. And it's like there needs to be a prohibition on, these are called gag clauses that prevent you from doing things. And so that got into the bill. That then became active in like 2021.
So help me with something on that, Dave, if you will. So the gag clause is you're essentially saying that an employer is entitled to access to data of the plan, claims data. And a carrier does not have the right to withhold that data. And the gag clause is centered around that, correct?
There's other gag clauses too, but that's like the critical one if you're going to win.
And so my question, though, is I know that in our business as healthcare consultants, we've had several run-ins with insurance carriers who refused to give claims data over because the employer, even though they're a large employer, they're in a fully insured chassis, they're in a fully insured plan, and the insurance carrier said, no, we are not turning that data over. This happened as recently as last year after this legislation was introduced into law. Do they have legal ground to withhold this? And do you see this every day as I do? Or what's going on?
Yeah, where it really comes up the most is about 2/3 of employers are in self-insured plans. And so, there may be more of a leg to stand on and makes more sense in a fully insured in that. Again, I'm not a legal expert, so don't take my comments as legal advice. But you kind of handing over the keys to them, right? You're probably not managing things closely in the vast majority of the cases. But in the self-funded case, you are definitely needing to do that. And that's where what you described is the norm. It's a deviant norm. But it's a norm where they're like, oh, this is proprietary data, or they'll throw out, HIPAA, it's like, no, that's not what HIPAA is. But HIPAA is like, oh, that's like, I don't know, a cross to a Dracula or something that scares people off. And so it's all smoke screens, right? And so, unfortunately, employers like Kraft Heinz are literally suing their carrier to get access to something that because they know as the employer, it's sue or be sued.
Right.
And you look at the first two class action cases, one, Johnson and Johnson, and I don't think this is a coincidence. It's a large pharmaceutical company, and some of
Yep.
the most egregious things they have in there is like paying $10,000 for a drug that you can easily get for $300. Like they can't, not that it's defense, but they really can't claim ignorance on that.
Right.
And then the
Right.
other one is Mayo Clinic as an employer. There's these, horrific out of network charges and things like that that are hitting the employees really hard. And again, they're a healthcare provider. They can't really claim ignorance about, prices on out of network claims and things like that.
Right.
And so, it's just begun. Jerry Schlichter, who's the lawyer that has two unanimous Supreme Court victories. It's public information that he has 21 different Fortune 500 companies that he's targeted. Hits about, I think, 8 of the 11 judicial districts. It's very strategic.
Yeah.
And it's sad, right, that we need to have that. But when the government fails in its duty to enforce the law, then kind of the de facto fourth branch of government becomes these class action guys. And fortunately, you don't need a lot of sacrificial lambs for it to clean things up. If you look in the retirement space, billions and billions or more in the pockets of retirees because that space got cleaned up. And so it's just, as I said earlier, healthcare is always 10 or 15 years behind. Now we have this law, and it's very clear the lawyers are putting together their cases. These are not lightweight people who've taken these cases. And the fact that Schlichter hasn't announced any shows, he's taken his time.
Yeah.
These are not easy cases to win. And they're expensive. And, those class action guys are kind of like the entrepreneurs of the legal profession. They take a big long-term bet that they can get payoff down the line. And if they lose that bet, nobody's paying their legal fees, right? It's on their name.
Well, and you're really talking though about something that it's just common sense to the core, right? We should not be fighting tooth and nail for access to information that's rightfully ours. It's why are they keeping this information so close to the vest? Why do we have to pry it out of their cold dead hands?
Unfortunately, there are we don't like to fight. We don't have dollars to go take on these guys. We just work with ethical folks. And so there's great TPAs, there's great PBMs that are happy to work in a way that any reasonable person would say is a fair deal. We want them to be successful and profitable, and we want to, address the cruelty, frankly, that the industry has foisted on individual Americans, and that's avoidable cruelty.
Yeah, well, kudos to you for being a part of getting that legislation passed, and the crafting of it. It definitely is a service to the American people. So thank you for your work there. So Marshall Allen is the first guy that I heard on stage in front of a large audience, or anywhere for that matter, say that we're in a healthcare bubble. And when he said those words, I just, it really struck a chord with me, because no one had said that before.
Yeah.
But I just said, God damn it, that motherfucker is right. We are in a healthcare bubble.
Yeah.
And the question is, so $3 trillion to nearly $5 trillion, when is the bow going to break? Or is the answer, power corrupts, absolute power corrupts absolutely, and $5 trillion of power is a lot of power. How long does this thing keep? How long does this bubble keep expanding before it bursts? What do you think?
I mean, it's a good question.
I really want to end it there. I want to wrap now, but it's I think so many of our listeners and viewers, I think, tune into this because they've just had it. They're fed up. They're in addition to brokers and advisors that are looking for any edge that they can get and looking for a competitive advantage and cost containment strategies and vendors and TPAs. We have regular red-blooded American people that are tuning in because they've been wronged by the system, or they had a mishap, or a readmission due to a botched surgery. And I think everybody, regardless of whether you're in the game of healthcare as we are or not, we're all touched by healthcare, and I think we're all a little done.
Yeah. Well, and I think it's the bubble question is, I don't think it's going to be like a bubble the size of the Hindenburg that's a singular thing. I think it's more like a bubble machine where there's little bubbles, and where we're seeing it, and we're big believers, and this is actually where you can solve things at a human scale, is at community by community level. And so we see places like in Northeast Ohio where it's a completely different landscape, and we're seeing these pockets, and then we're expanding them. They're growing. The benefits advisor there, it went from, and he was one of the guinea pigs in this with us, and it's now moving a lot faster. But he went from year one employer, 38 lives. Next year, 535 lives. Then 1342. Then 3600. And then this last year, over 5,000. He's going to get to 10,000 pretty quickly in a county that has maybe 200,000 people. Like, it's a legitimate alternative. Just like you go to some places have Kaiser Permanente, some don't. Right? It's now become an alternative, and so it's being able to replicate that model and. That's where at that local level, it really, really word of mouth works, and conversely, there's this term, used that called FUD, fear, uncertainty, and doubt, that industry incumbents will use to freeze status quo. It stops working when people can see what's working with their own eyes, right? Yeah. And they can say all the typical stuff and fear mongering, but when a bunch of private sector employers and then the county and then the school district and then the city are all doing it, and that's kind of a funny thing with the public sector, is it kind of has a bit of a shaming effect on the private sector, because they think, oh, we're more nimble and careful with our dollars than public sector, and they're getting their butts, kicked by public sector, and it's their dollars. And, that really drives word of mouth. So it is happening. I would argue the bubbles are bursting. It's painful in some cases, like in rural settings where you have hospitals closed because of, they're funded to do more stuff rather than more like a fire department. You don't hear about fire departments closing in, rural areas. Maybe they have volunteer firefighters and it's a little different model, right? But, but that's really where we see things going, is kind of this locale by locale. That's the analogy we've used a lot of times for what we're doing, is with how the way buildings are built is radically different than 25 years ago. And like healthcare, it's this very entrenched, very local thing. It wasn't like one day all the buildings that were inefficient and polluting, got raised, the next day they're all magically green built. The new rose over time in particular locales, the old waned over time. Over 20 years, completely different model, completely different industry supply chain. Yes, there were some places like, Austin and Boulder that were early adopters of that stuff. And that's what we're seeing here. In this case, the early adopters, though, are very much middle America, because they can't push more onto the backs of the people who can least afford it. So, the first responders and the manufacturing people and the truck drivers, right? They need our help now, and we can provide that help now, and then it can extend.
And so if you're a benefits advisor listening and you want to up your game, Health Rosetta is an organization that can help get you started down the path of breaking away from the status quo and learning and expanding your vision of what is possible for the organizations under your management and your prospective organizations. And it's I don't know if you care to share what the price of admission is, but what does a what does a benefits advisor pay to be a Health Rosetta member?
Yeah, no, I'm happy to share. So like a Bryce Heinbaugh, he was the guy in the Ohio example. So when Bryce joined, and this is what it is today, it's $3,495. And that gets you, it's about a year and a half. So you get onboarded a year and a half. So like you joined, July of 2024, you would be renewing January of 2026. So, 18 months. Mm-hmm. From there forward, it's a $1,495 annual renewal to be a part of that community. And so, yeah, Bryce was in that camp. Bryce is a great guy. He was very frustrated. He didn't know this stuff. We trained and tooled him. And the difference between Bryce and other people is he just went all in on it. Now, he didn't abandon his clients. He had a bridge, but he was like, I'm only doing new business this way. I'm not like, I can't do what I was doing before. I don't feel it's aligned with my moral principles. And so that's, it's kind of amazing, right? How fast how fast you can grow. We're not asking people like Bryce to take a vow of poverty to do the right thing. He's serving a lot of people. He's very successful, and doors are being opened for him into realms that he never thought imaginable. And
amazing.
He deserves that.
Yeah. Yeah. And so, that's kind of one population that you help.
Yeah.
But then if you're listening to this and you're an employer, you are charged with P&L responsibility. You are an HR executive that maybe you love your broker. I think most people do. I think brokers generally are very, very, they're social creatures. They're they're very what's the word?
There were guys in my college
charismatic,
great guys, right?
Yes,
they're doing
right. Yeah, you go out to the games and the shows and the dinners and it's fun, but you really got to take a beat and ask yourself, should we take a peek under the hood here and see if we could do a little better? And listen, hopefully you can't. Hopefully your broker is doing everything right.
The plan grader I talked about. Yeah. Just think of it as a second opinion, right? There's serious consequences for cancer. Well, there's serious consequences for your health plan. Like I said, third leading cause of death in America is preventable medical mistakes. And there are contractual terms that prevent you from guiding people to the best quality providers. That's not good for your members. And so that's the type of thing that we give the people tools to get that second opinion. They can see where they're at and then make a decision as to what they want to do. And so that's one of the reasons we have, if you go to healthrosetta.org/employers, we have tools there for employers. We'll connect you with advisors, things like that. I'm very accessible. Like you can just, find me on LinkedIn. I'll connect you with folks.
Awesome.
And I'm Dave at healthrosetta.org. Like it's easy to find me. And
it's not too late for folks to sign up for RosettaFest.
Yeah.
I hear your dogs.
Yeah, somebody arrived home, so that's the announcement.
Well, ladies and gentlemen, that's going to be our cue to call it a day. Dave Chase, thank you so much for all that you do. Thanks for being a part of this movement that has affected more lives than I'm sure you know. It's been my honor and privilege to be your host today. And I look forward to seeing you out there at RosettaFest. Yeah, definitely. It'll be great. And thanks again for having me on, and look forward to seeing you. Pleasure is mine. Have a great one. Ladies and gentlemen, until next time, peace.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. One lucky listener every single week who posts a review on iTunes will win a chance in the grand prize drawing to win a $15,000 value private VIP day with Ray Kober himself. Be sure to head on over to brokenhealthcarepodcast.com and pick up a free copy of Ray's gift and join us on the next episode.